Hi, this is Laura Hickson, and I'm going to give you an introduction to skin assessment. This is not the Chapter 14 skin assessment. This is just an introduction to help you with your discussion and what you're going to be doing in lab. So part of the introduction is understanding with the skin assessment, what are we going to assess? You're going to assess all skin, every area that's covered in skin. That's where you need to assess head, neck, shoulders, knees and toes, and in between. We're going to be looking for the skin color, the intactness, the integrity of the skin, and we are also going to palpate for temperature. We will be looking at nails, fingers, and toes. We are looking for the color of the nails, the shape and texture, and we will also talk about capillary refill or perfusion. When we look at the hair, we look at the color and condition and the distribution of hair. So as you can imagine, all these different things that you're going to assess can indicate some of the things that may be going on with your patient. So how are we going to assess these things? Well, we are going to inspect with our eyes using, doing this first. We're doing inspection as always first, but you have to have good light to see small, even subtle problems. You must look at all skin, nails, and hair for different coloration and integrity. We're also going to palpate with our hands. We use the backs of the hands because that's the most sensitive to temperature. And so we're going to check for temperature, texture, and we can assess for moisture or dryness. Some of the assessment tools that you're going to see is the Braden scale. We use this in the lab and in the hospital setting. So you're going to want to get real comfortable with how we use this tool to identify pressure sore risk. So you need to have good lighting. You need to maybe possibly have a pen light if you're looking at smaller structures. A measuring tape if we're looking at wounds. You might need gloves if you're going to be touching any body fluids or wounds or anything like that. But definitely this Braden scale identifies risk for pressure ulcers. Now, if a patient already has an existing pressure ulcer or they have poor nutrition or friction problems, this would definitely impact the score. So the higher the score, the less risk. When we talk about pressure ulcers, this is ulcers that are caused from unrelieved pressure, shear, or friction. We screen those patients with the Braden scale, and the risk factors to these things may be bony prominences, but basically it is pressure that's not relieved. So some risk factors might also include maybe the patient has decreased perception. For example, they have neuropathy or decreased mobility. Say if they have any contractures or if they've had a hip fracture, they are going to have a hard time moving that leg, and so that heel can be in consistent pressure for a period of time. The decreased nutrition and friction can also cause significant problems for these patients. Another skin diagnosis we'll be talking about is skin cancer. And skin cancer is basically abnormal growth of cells, such as a melanoma, basal or squamous cell carcinoma. We screen patients. We encourage them to do routine self-examinations, especially in places that they may experience excessive sun exposure or sunburns. Maybe if they've had radiation, those areas are susceptible to skin cancer. If there's a family history of melanoma or any pigment irregularities, we might encourage them to do even further screening. So we use the detection, the skin cancer identifying tool of ABCDE. A stands for asymmetry, and you'll see the picture here kind of gives you a visual of these things. Irregular borders, there may be some color variations within the macule, maybe the diameter is a lot larger, and it changes over time. And so we want to identify these things as a baseline for follow-up and monitoring if we're concerned. Another diagnosis you might discuss is infection. So the infection is the overgrowth of bacteria in a wound. Redness, warmth, drainage are some signs and symptoms of infection. Patients who are at risk have some type of impaired skin integrity, whether it be an IV, an invasive medical device, maybe a wound, incision, they're resident in a long-term care facility, their immune system is suppressed some way, and the bacteria uh, grows in excess. In advanced age, your immune system may not be as effective as well. So we always prevent with good hand hygiene, keeping the wounds covered, and good sanitary nail practices, which includes not having artificial nails of any kind. No powder tips, any of those kind of things. Bacteria loves to grow on those.